Have you ever wondered what a real patient call sounds like in a medical office? Many people preparing for medical receptionist or virtual medical assistant roles know English, but they struggle to answer patients' calls professionally. In today's video, I will show you exactly how to answer patient calls step by step, from greeting the patients to ending the conversation with confidence. So let's get started. Hello and welcome to Healthcare Skills Hub. My name is Nair, and this channel is dedicated to helping you develop the communication and practical skills needed to succeed in healthcare support roles. If you are preparing for a medical receptionist, patient support specialist, or virtual medical assistant position, you are in the right place. So let's begin. Step number one, professional greeting. The first impression matters. Speak clearly, smile while talking, and maintain a friendly, professional tone. Like, patient calls you, you pick up the call, and you may say, "Good morning, good afternoon. Thank you for calling ABC Medical Clinic. This is Sarah speaking. This is John speaking. How may I help you today?" Avoid saying hello. Instead, always identify the clinic and yourself. That will be more professional. Step number two, listen carefully. I will add something here. A patient calling you, they have uh, they have any issue going on, health related issue, any complication. So we have to be active listeners. Allow the patient to explain the reason for the call without interrupting. It's without interrupting. Okay, so I would like to schedule an appointment. You can say, "Certainly, I would be more than happy to help you with that." Verify the patient's information before discussing the appointment or medical information. Verify the patient's identity. You can ask for the full name, or first or the last name, date of birth, and phone number if needed. For example, "May I have your full name, please? Could you please verify your date of birth?" Now, you're going to check the schedule. If you need time to review availability, let the patient know politely. For example, "Please hold for a moment while I check the doctor's schedule." When you return, "Thank you for waiting." These are a few things you always have to remember. You have to thank the patient for waiting, because yes, they gave you time, they gave you some period to check the availability, to check the schedule. So offer the available appointments now. Present clear appointment options. For example, uh, Dr. Johnson has an appointment on Tuesday at 9 a.m. or Thursday at 2 p.m. Which appointment would you prefer? It's up to the patient. He can choose either 9 a.m. Tuesday or 2 p.m. Thursday. Once you get the confirmation, confirm the appointment, repeat the details to avoid any misunderstandings. For example, your appointment has been scheduled for Thursday, August the 6th at 2 p.m. with Dr. Johnson. So After that, you have to share some important instructions as well. Inform the patients about the arrival time and the required documents. For example, uh, please arrive 15 minutes early and bring your photo ID, insurance card, and any required paperwork. You can also ask them to bring their labs, if available, or the past prescriptions. End the call professionally. Always end the call with appreciation and offer additional help. Is there anything else I can help you with today? Patient says, no, thank you. You are welcome. Thank you for calling ABC Medical Clinic. Have a wonderful day ahead. Now, there are some common mistakes to avoid here. Number one, interrupting the patient. You have to be, as I said, that you have to be a good listener. Speaking too quickly, using slang or informal language. Like, I will give you a very small example. In US, we call the doctors providers. So most of the patients, you don't know who's the provider. You have to tell them that's a doctor. You are scheduled with Dr. Johnson. Forgetting to verify the patient's identity, which is the most important thing. You can pull out another patient, another Sarah Johnson or John Miller, instead of that correct patient. Ending the call abruptly. So these are the common mistakes to avoid. And closing, answer patients' calls professionally is one of the most important skills for any medical receptionist or virtual medical assistant. Practice these steps regularly and you will become more confident with every call. It's not a rocket science. It's just you have to be natural, you have to be more confident. If you found this video helpful, please like, subscribe, and turn off the notification for more healthcare training content. And yes, please leave a comment below and tell me which part of the answering patient calls do you find most challenging. Thank you for watching Healthcare Skills Hub. I'll see you in the next video.